Hello learners, I Dr. Amit Tapkir from Department of Pharmaceutical Chemistry, Modern College of Pharmacy, Nigdi, Pune. Welcome you all for today's section. Good afternoon students. Today we are going to discuss a new topic. The name of that topic is CNS Stimulants. The content of today's lecture is CNS stimulant or analeptics, classification of CNS stimulant, structure and chemistry of CNS stimulant, SAR, that is structure activity relationship, mode of action of CNS stimulant, and the uses of CNS stimulant. So first we see what is the CNS stimulants. CNS stimulants are also known as analeptics. Analeptics are central nervous system stimulants that include a wide variety of medications used to treat depression, attention deficit hyperactivity disorder, shortly called as ADHD, and respiratory depression. These are called as CNS stimulants. CNS stimulants or the analeptics are majorly classified in following classes. The first class is the analeptics used in narcolepsy. Narcolepsy means sleeping syndrome, and used as a respiratory stimulant. This is the first class of analeptics medicinally used nowadays. Second class of analeptics are central sympathomimetic agent, or they are also called as a psychomotor stimulant. And third and last class of a CNS stimulant or analeptics is hallucinogen. So we will see the one by one. The first is the CNS stimulant used in narcolepsy and the respiratory stimulant. Under this class we are going to see the four drugs which are listed on your screen. The first drug is a picrotoxin. Second drug is a fentanyl tetrazole. Third drug is a modafinil, and fourth drug is a doxaprom hydrochloride. So first we see the drug picrotoxin. The name picrotoxin is the combination of two words. One is a picros and second is a toxicon. So meaning of picron is a Greek word. Meaning of picron is a bitter, and toxicon means poison. So it's a bitter poison. It's called as a picrotoxin. But nowadays it's not a toxic, and the use are very safer. Traditionally it is used as a toxin. That's why it's name given as a picrotoxin. That is a bitter poison. It is used as a central nervous system stimulant. It stimulates central nervous system. It is also used as an antidote. It used in a convulsion disorder because it acts on a GABA receptor. It's a GABA receptor antagonist. All of you know that GABA is the ion channel receptor. It's a chlorine ion channel receptor. So it's antagonizes that chlorine. This, if you look at the structure of a picrotoxin on a slide, it's a three fused ring system in which two rings are hetero ring and one ring is not hetero ring. So this is about the structure of a picrotoxin. It's a little bit complex structure. Try to remember this structure. Second drug is a fentanyl tetrazole, come under the same class. Fentanyl tetrazole, the name gives you a idea about that. It's a tetrazole derivative. Tetrazole, the name gives you idea that tetra means four, and azole means nitrogen. So four nitrogen containing ring. And ol gives you a idea that ol means 5-membered ring. So it's a 5-membered ring having a 4 nitrogen and fully unsaturated ring. This ring is infused with azepine ring, and attachment is at 1,5 position, that is 5A position. The fentanyl tetrazole are shortly called as a PTZ. It acts on picrotoxin, that is a PTX site of the GABA receptor, that is a gamma aminobutyric acid type 1 receptor. So the action is again same as to the picrotoxin. Next drug is modafinil. Modafinil, if you look at the structure at your screen, modafinil is the acetamide derivative. Acetamide is a CH2 carbonyl NH2. CH2 C double bond O NH2 acetamide. It's acetamide derivative. Which functional group present on acetamide? The 2-benzhydryl sulfonyl. 2-benzhydryl sulfonyl. Sulfonyl S double bond O. So it's a 2-benzhydryl sulfonyl acetamide. This modafinil as an atypical alpha 1 norepinephrine. Norepinephrine means noradrenaline. Norepinephrine, any receptor stimulant. It used to treat daytime sleepiness in narcolepsy patient. Those patient, they are sleeps in a daytime. So if you administer or if you recommend this drug, so they can overcome their daytime sleep with the help of this CNS stimulant or the analeptic. Next drug is a doxapram. Doxapram is a diphenyl pyrrolidine 2-one derivative. If you look out the IUPAC name of a doxapram is a 1-ethyl at a 1 position, that is at a nitrogen, the ethyl substitution. At a 4 position, the morpholino-ethyl. Morpholino is a heterocyclic ring in which nitrogen and oxygen, these two heteroatoms. This is a 6-member ring. Morpholino ring doesn't have any double bond inside the ring. This morpholino ring is attached with pyrrolidine at a 2 position by 2-ethyl group. That's why it's a 2-morpholino-ethyl. 2-morpholino-ethyl. 4-eel means attachment to the pyrrolidine at a 4 position. That's why 1-ethyl. 4 indicate the attachment to the pyrrolidine ring. 2-morpholino-ethyl. 3,3 diphenyl. 3,3 means at a 3 position diphenyl substitution, and the basic nucleus is a pyrrolidine 2-one. It's a respiratory stimulant administered intravenously. Doxapram stimulate an increase in a tidal volume and increase the respiratory rate. So it used in a respiratory depressed person. Doxapram is a very good drug. Then we see the next class of a drug which are used in analeptic and which is used to overcome the sleepiness. This is a very famous class. All of are aware about this class of a drug because we are taking or some peoples they are like to drink tea, coffee. This tea and coffee contains caffeine, theophylline and theobromine. So these caffeine, theophylline and theobromine which are present in a coffee, your regular coffee, these are the xanthine derivatives. Xanthine derivatives, if you look in your screen, look out at screen, then xanthine is nothing but a purine. It's a purine 2,4-dione. 2,4-dione means at a 2 position and 4 position, the carbonyl, that is a dione functional group, is present. That's why xanthines are the purine 2,4-dione class. If you look out the caffeine structure of a caffeine, the first derivative of a xanthine, caffeine is a 1,3,7 trimethyl substitution. What is the difference between xanthine and caffeine? If you substitute 3-methyl group at a position 1, 3 and 7, you will get the caffeine. So caffeine is nothing but 1,3,7 trimethyl purine 2,6-dione, or we can say simply 1,3,7 trimethyl xanthine is nothing but caffeine. If you look at the theophylline structure very peacefully, so you can easily find out what is the difference between the caffeine, theophylline and xanthine. Theophylline is a dimethyl substituted xanthine. Caffeine is a tri-substituted. Theophylline is a disubstituted, and theobromine is also disubstituted. If you look at the theophylline is a 1,3-dimethyl xanthine, and the theobromine is a 3,7-dimethyl xanthine. Xanthine is nothing but a purine 2,4-dione. That's why rather than talking purine 2,6-dione, I am using the word xanthine. So I repeat, caffeine is a 1,3,7 trimethyl xanthine. Theophylline is a 1,3-dimethyl xanthine. Theobromine is a 3,7-dimethyl xanthine. So these three derivatives, caffeine, theophylline, theobromine, these are the analeptics we can use in a sleeping syndrome, and we can use as a respiratory stimulant. If you look at the SAR of structure activity relationship of the xanthine derivative, then the nitrogen 1 and the substitution at 8th position is essential for the adenosine antagonist activity. If you look out the carbonyl functional group at a 2 and 6 position, or we can simply say that the purine basic nucleus is an essential pharmacophore to be an CNS stimulant. So purine is an essential requirement to be a drug as an effective CNS stimulant or the analeptics. The N3 substitution increase the bronchodilator activity. N3 substitution. If you substitute anything at a position 9 nitrogen, then the compound becomes less potent. The nitrogen 7, if you substituted, then there is a decrease in the bronchodilator activity. This is about the SAR of xanthins, or the SAR of theophylline, theobromine and caffeine. With this SAR, we will move to next slide. Mode of action of xanthin alkaloids. The xanthins, the xanthin alkaloids, the major pharmacological action of the xanthins are inhibition of a tissue phosphodiesterase. It inhibits tissue phosphodiesterase, which increase the cellular cyclic AMP levels by inhibition of its breakdown and metabolism. This is the one way of action of xanthin alkaloids. Second, xanthin also adenosine receptor antagonist. These are the adenosine receptor antagonist, and that's why xanthin also stimulate muscle and cardiac cell and neurons. This is the second way by which the xanthins are act. After the completion of xanthin, we will move for the next class of analeptics are called as central sympathomimetic agents. Central sympathomimetic agents. These agents are phenylethylamines. These agents are the phenylethylamines, means phenyl ring, then ethyl and amine. If you look at the structure of amphetamine, you will get feel about these are the phenylethylamines, in which the second carbon is substituted with the methyl group, is nothing but amphetamine. If you look at the structure of methamphetamine, what is the structural difference between amphetamine and methamphetamine? Only one more methyl is substituted at a nitrogen. You will get the structure of a methamphetamine. If you look out the third derivative of central sympathomimetic agent, phentermine. Phentermine, what is the addition? All of you know that amphetamine at the second carbon, the methyl. If you add one more methyl, you will get the structure of phenamphetamine. If you add one more methyl in amphetamine at the second position, then you will get the phentermine drug structure. The fourth derivative of a central sympathomimetic agent is a benzphetamine. Benzphetamine, the alkyl chain is not substituted, phenyl is not substituted, carbon is not substituted, but the amino, the two protons, the two hydrogen atoms of benzamphetamine is substituted with one methyl group and one phenyl group. So N-methyl and phenyl, phenylethylamine is nothing but amphetamine, is nothing but benzphetamine, whereas the one second carbon contain a methyl group, same as amphetamine. If you add the two groups on nitrogen, that is a methyl and phenylmethyl on amphetamine, you will get a benzphetamine. The next derivative of central sympathomimetic agent is a diethylpropion. Diethylpropion, the carbonyl functional group, then the second carbon contain only the methyl, and the nitrogen is substituted with the diethyl, NN-diethyl, and the rest of the structure is the same as to amphetamine. What is the change? What is the structural difference between amphetamine and diethylpropion? The nitrogen is a disubstituted with the diethyl, and the one carbon from alkyl is substituted with the carbonyl. This is the structure of a diphenylpropion. Other central sympathomimetic agents are nicotine and cocaine. The mode of action of a sympathomimetic agents, it's a variety of action of sympathomimetic agents because it acts on a lot of receptors. All of you know that the sympathomimetic agents acts via ANS. It sodium dependent noradrenaline transporter stimulator. It's a sodium dependent noradrenaline transporter stimulator. The second way how this acts, it's alpha adrenergic receptor agonist. In addition to this, it's also beta adrenergic receptor agonist. It's a dopamine D2 receptor binder. It's amine oxidase B inhibitor, flavin containing. It is a sodium dependent serotonin transport binder, and lastly, it acts by the monoamine oxidase inhibitor, that is MAO inhibitor. These 4 or 5 6 ways these sympathomimetic agents are act as an analeptics or the CNS stimulants. The use of these sympathomimetic agents, it is used in the treatment of attention deficit hyperactivity disorder. Those students, they are unable to learn properly. They have less attention. They are unable to recall the things, or those people, they are unable to recall the things in that patient. In that attention deficient patient, we can use this drug to improve their attention ability. This drug are also used in narcolepsy, means those people are feeling sleepy at the daytime also. In narcolepsy, this drug are used. This drug are also used in obesity, obese patient, to treat the obese patient. So you can see the narcolepsy, obesity, attention deficit disorder, these are totally related to the depression, depressive states. So that's why these are the stimulant to overcome the depression. Next class of CNS stimulants or the analeptics are hallucinogens. Hallucinogens is a psychoactive agent that's often or ordinarily causes hallucination, perceptual anomalies, and other substantial subjective changes in thought, emotion, and consciousness. The example, very nice example of hallucinogen is the LSD. LSD means lysergic acid diethyl or the lysergic acid derivatives are used as hallucinogens. The hallucinogens or the lysergic acid diethyl LSD reduce alcohol consumption in some alcoholics. So it is used to treat the alcoholic patients. It reduces the alcohol consumption in alcoholism. LSD has also been studied in depression, anxiety, and drug dependence. This drug, LSD, are used in depression, depressive patient, anxiety patient, those patients who are in worry, tension. These patients are treated with LSD. This drug are also used in a drug dependence. So this is about the analeptics or the CNS stimulants, in which we seen the 3 types of drugs: mode of action of the xanthine alkaloids, centrally acting sympathomimetic agents, and the hallucinogens.